Now, let us have a discussion on management of hypertension in diabetic patients, which is very common, as you know very well, that diabetes and hypertension coexist together. So the discussion is how to manage diabetes or how to manage hypertension in diabetic patient. So you start by first of all understanding your patient very well. After you take the history of your patient, you categorize your patient. So in the initial piece is that if the blood pressure is between 140/90 and 160/100, then start on one agent of the drug. Obviously, this is after managing the lifestyle of the patient, like advising not to have stress, do exercises, maintain the weight, keep away from salt, keep away from fat, all those type of things. But now you have to start investigate your patient. You look for urine, whether there's albumin in the urine. If there is no albumin in the urine, then you can start your patient on one type of the foreign drug. But use ACE inhibitors, like for example, you can use enalapril, captopril, lisinopril, or you can also use RBI like losartan, valsartan, and those type of drugs. Then you can also use calcium channel blockers like pedifin. You can also use amlodipine, or also you can use the diuretics like hydrochlorothiazide or allopurinol if the patient does not have protein or albumin in the urine. But if the patient has albumin in the urine, you start questioning the integrity of the glomerular. Then you have to start your patient on either AC inhibitors or RBI. That is either of them because they work at the kidney. But those type two drugs, they inhibit the renin angiotensin, renin angiotensin and aldosterone pathways. So you have to be very careful about that. Is the way you are supposed to check on that one. So if if you assess your patient and see whether you, you have to assess for the whether are you getting controlling the blood pressure, is there a side effect of the drugs? For example, AC inhibitors, they have dry cough. Calcium channel blockers, they have edema of the lower limbs. Sometimes they can even cause rebound headache. They can cause rebound hypertension. Diuretics can cause electrolyte imbalance, so you have to monitor those side effects of those type of patients. Then, if the treatment is tolerated and you achieve the target, then continue that treatment. But if you are not meeting your target and any other complementary drugs agents, you can add ACE plus or ARBI or calcium channel blockers plus diuretics. If and then you continue monitoring the side effects of these drugs. Remember, diuretics can cause electrolyte imbalance. Thiazide can cause hyperlipidemia. Thiazide can cause insulin resistance. So you have to continue monitoring the side effect of these drugs. So in this case, if the adverse side effect, you consider to change the drugs to either AC inhibitors, calcium channel blockers, or RBI. Then if you have not met the target of the two agents, you can go back again and do it again, adding another agent. If the blood pressure is controlled and adverse effect not meeting the target, then you consider adding things like mineralocorticoids, receptor antagonist, or you can refer to a specialist for further management. But if the treatment is tolerated and you're achieving the target, then you continue the treatment. On the other side, if the patient has a blood pressure of 160/100, you start on two agents of the drugs. You check the kidneys, check for the albumin. If there is no albumin, you can start with drug from two to three of the options. So you can either use AC inhibitors or ARBI. You can use calcium channel blockers, diuretics, the three types of drugs at the same time. Or you can start AC inhibitors or RBI with calcium channel blockers or diuretics. Then we continue the way pathways like that. Remember, this type of treatment is based on population, how many number of people can be able to achieve this type of treatment. Thank you very much for listening to this one. So in the management of diabetic hypertension, remember you have to consider then side effect of the drug, the tolerability of the drug, and also achieving your target. You have to achieve your target and the patient should be safe. Thank you very much for listening to this type of lecture. Thank you very much.